The concept of Ashrayaashrayee bhav is a foundational principle describing the interdependent relation between the doshas and dhatus in the body. It explains how changes in doshas can directly affect and impact the dhatus they reside in, leading to health or disease depending on the state, whether it is. In further two slides, one can see the sandhi and samas. तत्र अस्थिनि स्थितो वायुः पित्तं तु स्वेद रक्तयो श्लेष्मा शेषेषु तेन येषाम् आश्रयेण मिथः यद् एकस्य तदन्यस्य वधेन शपन औषधम् अस्थिमारुतयो नैव प्रायो वृद्धिः तर्पणात् श्लेष्मणा अनुगता तस्मात् संशयः तद्विपर्यात् वायुना अनुगतः शेषेषु रसमांस मेदो मज्ज शुक्र मूत्र पुरीश प्रभृतिषु. Ashray, which is the host, that is the tissues that provide a home or a seat for a specific dosha, whereas Ashrayi, which is the guest, that is the dosha that depend on and reside within that dhatu. Vata dosh is located in the asti. Kapha dosh is located in the rasa, mamsa, meda, majja, shukra and malamutra, whereas pitta dosh resides in the rakta and sveda. The causative factors which are responsible for the decrease or increase of the ashrayas also cause to increase and decrease of ashrayas respectively, except in the case of vata. So example, if vata increases, then asti decreases. If pitta increases, rakta and sved also increases. If pitta decreases, then rakta and sved also decreases. Similarly, if kapha increases, then rasa, mamsa, meda, majja, shukra and malamutra also increase. The relationship between dhatus and doshas can be affected by various factors leading to three types of outcome. The first one is samya avastha, which is the balanced state. Both the doshas and the dhatus are in balanced state, leading to optimal health and function. Second is riddhi avastha, that is the increased state. That is, if a dosha is increased, it can overstimulate the dhatu it resides in, causing it to be affected or weakened. For example, an excess of vata can lead to weakened bones. Kshaya avastha, that is the decreased state. If a dosha is depleted, it may reduce the functions of its associated dhatu. For instance, low kapha can result in poor nourishment and dehydration. Generally, increase of all dhatus are due to the overnourishment and predominance of kapha. Nourishing therapies increases kapha and all other dhatus, but it reduces vata. Reducing therapies decrease all dhatus, but it increases vata. The diseases caused by increase or decrease of dhatus is to be treated with reducing therapies respectively, except in the case of vata. The use of substances, quality and action either opposite or similar but not antagonistic to the drugs, dhatus, is to be planned appropriately. Now let us see its clinical significance. Ashrayaashrayee bhava is significant in treating and diagnosing diseases. An Ayurvedic practitioner considers the relation between dhatus and doshas when planning treatment, aiming to restore balance. For example, if a patient has joint issues related to asti, then vata management will be more in focus. Skin and blood issues might require balancing pitta. Conditions involving fluid retention might involve balancing kapha. By understanding this concept, Ayurvedic treatments aim to restore harmony between the doshas and dhatus, the dosh imbalance and disease manifestation. When a dosh becomes vitiated, it occupies a specific dhatu or organ leading to disease. For example, the disease caused is joint pains, that is sandhivata. So the ashray will be joints, that is the asti dhatu, and ashray will be the vata dosh. Talking about its clinical approach, treating the vitiated vata dosh with therapies like snehan and swedan, alongside nourishing it with asti dhatu with calcium-rich herbs like shatavari and ashwagandha. Parasite-host relationship. Parasites or pathogens can use the body as ashray, disrupting normal physiology. For example, the disease is worm infection. So the ashray will be the GI tract and ashray will be the parasitic worms. Talking about its clinical approach, using Kremigna dravyas, that is anti-parasitic herbs like Vidagna or Mushti to eliminate worms alongside strengthening Agni, which is the digestive fire, to prevent reoccurrence. Allergy and hypersensitivity. In allergic conditions, the body reacts to external allergens that act as ashrayees. For example, a disease is skin allergy. Ashraya will be the skin and Ashrayee will be the external allergens like pollens and dust. Talking about its clinical approach, managing kapha and pitta doshas using anti-allegra herbs like turmeric and neem and strengthening immunity through rasayan therapies. And fourth is the chronic conditions and tissue degeneration. In chronic illness, the interplay of Ashraya and Ashrayee leads to progressive tissue damage. For example, the disease caused is osteoporosis. So the Ashraya will be the bones and the Ashrayee will be the Vat dosh, that is aggravated drying effect on tissues. Talking about the clinical approach, balancing Vata with oleation and rejuvenating the bones using herbs like Laksha and Hadjoda along with dietary modifications. Thank you.